All right. I think, yeah, we've passed 9 o'clock, and I see that most people are here. Welcome, everybody. If there are people coming in, please make your way in. We're going to begin. My name is Lucille Collard. Mon nom, c'est Lucille Collard. Je suis la députée provinciale pour Ottawa-Vanier. So it's a real pleasure to be here with my colleague and friend, Mona Fortier. Before I invite Mona to come and speak to us about the announcement I wanted to say just a few words because this announcement this morning is actually important to me. Of course, in an ideal world, no one would struggle with addictions, but the reality is that there are people who need help so they don't die from their consumption. And that help can take the form of harm reduction, of prevention, and treatment services. And all these tools are important to fight this public health crisis. 17 years ago, November 2006, my brother died of an overdose alone in a shelter here in Ottawa. So I guess you can say that I have a true understanding of the importance of supporting the services that we are here to talk about. And I know that my colleague, the Honorable Mona Fortier, also understands this, and it is therefore my pleasure to welcome to the podium the President of the Treasury Board and my friend, Mona Fortier.
On apprend quelque chose à tous les jours. Merci d'avoir partagé, Lucille. C'est pas facile, mais c'est pour ça qu'on est ici aujourd'hui. On continue à travailler fort pour notre communauté. Good morning, everyone. How are you? Okay, I'm really good because the house rose at midnight last night, so I'm very happy to be here. And I've had a lot of coffee, so believe me, I'm in a good mood. Alors, bonjour à tous, kwe, hello everyone. Before I start, I would like to acknowledge that we are on the unceded territory of the Algonquin and Anishinaabe people. Puis, merci beaucoup encore, Lucille, d'être avec moi ce matin. On fait vraiment bonne équipe. C'est tellement important qu'on soit ensemble, puis qu'on puisse continuer sur cette question tellement importante dans notre communauté, on le sait, et partout dans la région de la capitale-nationale, évidemment. Catherine, merci d'être là ce matin. You're the chair of the Health Committee, so it's really, really important for you to be here, and I want to acknowledge the fact that you are here. And as we know and can share now, this is something that is very close to our hearts. As we continue to work closely together to support those in our community who are struggling with substance use. And although she couldn't be here, Minister Bennett really wanted to be here with us today, the mental health minister, who has been here not too long ago to better understand and to get to where we are today. So I want to acknowledge her and also recognize our mayor, Mark Sutcliffe, who also was going to be here, but he has a special visitor from Toronto, so changed his course, but wanted to make sure that everybody knows that he is very supportive, and also Ralston King, the counselor for Rideau Rockcliffe, who also is in meetings. It's a very good day, though, because we do have full support. Having friends at City Hall to ensure all levels of government are prioritizing the well-being of our community is crucial. And I also want to thank Pathway to Recovery for welcoming us here today and giving us a tour of their clinic. Where's Donna? There you go. Thank you so much. This is really invaluable. You save lives every single day and play a key role in supporting the vulnerable in our community, and also recognize all the team members that play that role. Vous savez, trop souvent, les personnes qui consomment des substances se retrouvent à des portes fermées lorsqu'elles ont besoin de soutien. Les sentiers du rétablissement s'est donné comme mission de faire tomber ces barrières et d'offrir un chemin vers le bien-être. Et notre gouvernement vous soutient dans la réalisation de cette tâche importante, tout comme moi, je l'ai mentionné, Lucille, Catherine et tous les collaborateurs dans notre communauté. En Ontario, le nombre de décès par surdose d'opioïdes est l'un des plus élevés du pays, avec plus de 7 000 décès. Et nous savons tous qu'il ne s'agit pas de statistiques. Ce sont des parents, des amis, des collègues, des voisins, nos enfants. Ce sont des membres de notre communauté et malheureusement, certains d'entre eux font partie de la communauté d'Ottawa-Vanier. And all of us have been touched in some way by this crisis, and we must prioritize bold policy change and go full steam ahead with the way we deliver support, including harm reduction in addition to prevention, enforcement, and treatment, which unfortunately some of our opponents and members of our community do not understand. And we have to address the reasons why people use substances in the first place, whether that be physical pain, emotional pain, or even both. And we need to try new things. When it comes to saving lives, we must use every tool at our disposal, from health and social services to mental health care to treatment. And there is no recovery path for people who are dead. Lucille et moi sommes ici pour soutenir sans réserve les plans audacieux de réduction des risques, car une vie perdue à cause de la consommation de substances est une vie de trop. Ici, au Sentier du rétablissement, vous voyez les résultats tous les jours et votre travail important, je dirais même essentiel, contribue à la constitution d'une base de données probante autour de cette pratique qui est émergente. And on this note, I am honored to highlight that Pathways to Recovery is receiving more than $1.9 million through Health Canada's Substance Use and Addictions Program to expand its Safer Supply Ottawa initiative. Yes. And this funding is part of a $37 million bundle announcement by Minister Bennett for community organizations across Canada. Pathways to Recovery, which has already received $5.7 million through this program, offers high-quality, patient-centered care to vulnerable people in our community struggling with complex health issues. And this includes providing a pharmaceutical alternative to the toxic illegal drug supply by prescription for people who use drugs. And working with its partners, the Safer Supply Ottawa initiative will expand these services at 5 sites in Ottawa, which will allow them to provide wraparound services, including access to nurse practitioners, peer support, and counseling. And this is about saving lives. It's about showing up for a community, putting people first, and supporting those who need it the most. Now, thank you to all organizations participating in this project. Thank you for putting people first. And again, merci to Ottawa Inner City Health, Sandy Hill Community Health Center, Somerset West Community Health Center, Respect RX PharmaSave, and Recover Care for your continued efforts every day to enable the community to have this service. Vous savez, je vais le répéter, le travail que vous faites sauve des vies et fait une grande différence pour toutes celles et ceux qui vivent dans cette communauté. Et en apportant un soutien non stigmatisé aux personnes qui consomment les substances, vous les aidez à faire les premiers pas, difficiles, mais vers une meilleure santé. And I'm very proud to stand with you as you care for people with compassion and understanding. So thank you, merci, miigwech nakumik. And now we get to hear from Donna Sarazin, who is an incredible leader in our community. Thank you so much, Donna. I will let you speak now and give you some space.
Good morning, everybody. Thanks for coming. Thank you, Minister Fortier. I'm going to read. On behalf of Pathways to Recovery and Safer Supply Ottawa project, I'd like to thank Health Canada for the continued dedication and support for the Safer Supply Ottawa program. Safer Supply is an intervention geared towards individuals impacted by the toxic illegal drug supply. Simply put, Safer Supply saves lives. Funding for the Safer Supply Ottawa project has brought together community partners in an amazing collaboration, including Ottawa Public Health, Recovery Care, Ottawa Inner City Health, Somerset West Community Health Centre, Sandy Hill Community Health Centre, Options by Town, and Respect RX Pharmacy. They deliver the Safer Supply Ottawa program while introducing individuals to wraparound services including primary care, mental health, infectious disease, housing supports, peer-led programs, and much more programs. The funding also supports the University of Ottawa School of Nursing research team to complete vital safer supply research. To date, this research has shown that over 80% of individuals who are experiencing ongoing overdoses at the time of starting safer supply are consistently no longer reporting overdoses. In addition, 57% of individuals that were not connected to primary care services are now receiving primary care. 60% of individuals on safer supply are now working with a housing worker to engage with community supports, and on average, 5 people each month are achieving stable housing. In addition to our gratitude to Health Canada and Pathways to Recovery and the Safer Supply Ottawa program, would like to thank the individuals that show up day after day to deliver these services in the Safer Supply program. Thank you to the physicians, the physician assistants, the NPs, the nurses, the social workers, the counselors, the housing workers, the medical assistants, peers and harm reduction workers, all part of this program. Without your dedication and compassion, these achievements would not be possible. Finally, I'd like to share a story provided to me from a Safer Supply patient. He wanted to be here today, but he wasn't able to be. So I'll read it for him. Hello, my name is Jeremiah. I'd like to share my story. Fentanyl on the streets killed me over 5 times. Narcan brought me back. Enrolling in the Safer Supply program provided me with a safer, clean supply, which kept me alive long enough to make up my mind, see the light, and get help. Without the Safer Supply program, I'm unsure if I'd be here today to see my siblings grow up. My doctor, Dr. Mark Tricardon, who's here with us today, treated me like a special individual. He helped me through this phase and this transition of my life. Today, I'm gainfully employed. I'm enjoying the best parts of life, and I'd like to express how thankful I am for the help, the cleaner, safer supply program, and the compassion from the team. My family would also like to thank the Safer Supply program for giving me back to them. Jeremiah is a real person, and he's just one of the lives being saved by Safer Supply. Thank you.
Thank you. I will pass it over to Anne for the questions from the media or the assistants. Thank you.
Bonjour tout le monde, on va faire la période de questions. On va commencer par les questions dans la salle, après ça on va se tourner vers le Zoom. On demande que quand vous arrivez au micro, vous identifiez votre média et votre nom. Et on demande une question et une question de suivi. So we're going to start the question period here in the room, and then we'll turn it over to Zoom. When you come to the microphone, please indicate your name and the media you represent. We ask that you ask one question and one follow-up. Okay? Any questions in the room? Marie-Pierre, à toi sur Zoom. Oh, sorry. Pas tout de suite, Marie-Pierre. On a une question ici.
Pas de problème.
Hello, I'm Natalie Van Roy with CTV Ottawa. I wanted to confirm this is new money, this funding. It's new money for this program.
Yes, it is new money.
Okay, and once again, how will it be outlined over the following weeks, and how will it be rolled out?
Well, thank you for that. I think I should maybe ask Donna, who probably has a better idea of how the money will be rolling out, but I have to say that the federal government is a partner into making sure we find different solutions to help community members who are suffering from drug addictions and other substances, and that's why we partner with Pathway to Recovery. Maybe Donna, you want to explain how this money is used?
Sure. Thank you for your question. So Pathways to Recovery provides support to the various organizations, the signs behind me, the Somerset West, Sandy Hill, Inner City, Options Bytown. So Pathways to Recovery disperses that money to them, and there are several sites that deliver the Safer Supply program. Somerset West recovery care, and inner city health provide prescribing services as well as wraparound support. So all of those services that I mentioned are partially funded through this money that comes. It allows the practitioners, the nurse practitioners, the physician assistants to continue offering primary care, to offer the mental health programs, the harm reduction programs, the housing support services are all supported by this money that comes from Health Canada, and across all of the organizations that are partnered with it, it gets dispersed. Does that answer your question? Thank you.
Right now, is there a wait list for these services? And if so, how long is that wait list?
Some of the sites have less capacity. Patients are always triaged. So somebody who needs to be receiving services receives services. There's no wait times. Individuals can walk into any of the service providers and be seen the same day and be appropriately put into treatment.
OK, on va se tourner vers Zoom. Marie-Pierre, à toi la parole.
Bonjour. Alors, si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Et juste veuillez modifier votre nom dans le Zoom pour indiquer votre nom et quel média vous travaillez pour. We will now proceed to questions from journalists online with Zoom. If you are a reporter and wish to ask a question, please use the hand-raising function. We ask that you limit yourself to one question and one follow-up. Please modify your Zoom handle to reflect your name and your media outlet. I don't think we have any questions on Zoom either, so I'll turn it back to Anne in the room.
And I just want to add something for everyone. I was here a couple of months ago with Dr. Bennett and other members of the community, and I was struck by how many people this program has helped over the years. And I believe the data, the number I have in mind is 831 that you had said. 550. But you had 831 members of the community, if I'm not mistaken, that were participating to the program.
I think it's just over
550? Okay, so imagine, I'm wrong with my number, but it's still important to say 550 people are being helped and supported. And it's not just a question of drug addiction, it's also their lives. Like when you talk about housing, you talk about how they can be back in the community and be able to work, maybe be able to contribute, take care of their kids. Those stories I heard, they are striking. And that's why we really need to continue these measures in our community, especially in Ottawa. And it's not just an Ottawa-Vanier situation. It's an Orléans, it's a Canada. It's not, necessarily a person that might not have a home. It could be somebody that does have a home. So I think we really need to make sure we educate the public. And that is something that in my role with Lucille, with Catherine, we all have a role to really share in public how important this program is. So I just wanted to state that again. Merci.
Merci beaucoup à tous. This concludes today's event. Ceci termine l'événement d'aujourd'hui.